Hello everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Well, today our topic is going to be about macular degeneration. Right, it's an eye disease. This is an eye disease. So macular degeneration, you probably heard about people say AMD. What is AMD? Age-related macular degeneration. Okay. Now, this new topic, this is what we're going to talk about. So, macular degeneration is a common eye disorder that causes central vision loss, right? So, your central vision is what you see when you are looking straight ahead, right? So, there's another version called what we call side vision. Okay, side vision and center is quite different. Okay, one is when you look straight, the center. If your my hands in here, this is center. This is center version, and around on the side, things that on the side, there's side version. It also called peripheral version. I think that probably the side way. Just around it, things around it. Apart from center, things around it is two different version. Okay, and what is actually macula? Macula is actually a very small area. It's a very small area at the center of your retina. So a small area in the center of the retina. It actually in Chinese macula called 黄斑. 黄斑. What 黄斑 means is a small area that is yellow color, right? So it's very interesting because in Chinese medicine we name that macula into color as well. So it's the red. When you look at it, it's actually red color. Yellow color. 黄斑, yellow color. So we call it yellow macula, right? So when we say yellow macula, it's actually more to do with the spleen and stomach, because spleen and stomach is yellow. The nutrition go to spleen and stomach is actually yellow, right? Although the eyes should control by the liver and gallbladder, but it doesn't mean that macular degeneration, this disease, is just related to the liver and gallbladder. It can related to stomach and spleen function, according to Chinese medicine, right? So the macula, right? We said that it is in the center of the retina, right? What is the function actually? Macula is the light sensitive inner lining of the eye. It's one very thin tissue, right? It is very sensitive to the light, right? The macula contains the highest concentration of light sensitive cells. It's the highest one. The concentration of the light sensitive cells. So these cells are responsible to detail central and color vision. Detail and color. So if this one is lost, so there's one symptom that is actually you get a black spot. You don't see the center, and the color is gone. So one of the symptoms of this is it actually you get a black hole in there. Now something in the black. You look at things, but in the middle there's something black in there, right? So center vision is needed for seeing straight ahead as well, and is used in tasks such as sewing, reading, and driving, right? So in AMD, which age-related macular degeneration, right, center vision become disordered, right? So the center vision it becomes disordered. So with AMD, there are two different types. All right. So there are two different types. And one type is we call dry AMD. The other type we call wet AMD. What that means is um, version loss may be a gradual process in dry AMD, or a sudden one due to a leakage of blood vessels, wet AMD. So what that means is when the macula it wear off its function and it hasn't got enough blood circulation to the macular lining. And that one, compared with the other one, it hasn't got enough blood supply to the macula, and so your body try to create a vessel, a few vessels, not just one, to supply the blood. And this one with multiple, a few new vessels develop, we call it wet AMD. The other one, which we haven't got any extra vessel, then compared with the other one, it called dry AMD, right? So in Western medicine, there are treatment available, but the treatment is only available to help prevent further loss of vision in wet AMD. Unfortunately, there is no treatment for dry AMD. Right? So measures to help prevent vision loss may include nutritional supplement, lifestyle measures such as not smoking, eating a nutritious diet, and exercise regular as also very important. Now, to be honest in here, do you know that we said about you lost the vision, right? It's gradually happen. You see this black spot in there, and you see that when you look at line, it actually curve. You have curve in there. This thing comes gradually, progressively getting worse. With the wet one, you can get injection to your eyes. It's painful, and it has side effect as well. And it try to prevent the vision loss, right? But I haven't seen any of our patients that have very good result for that. They may have some effect. So either Western medicine or Chinese medicine or acupuncture, the optimal goal, the first goal that we want to reach is prevent it to go worse, right? Prevent it to go worse. If anything, that we want it to be able to improve, right? And there's not much that Western medicine can do at the moment, but we found that acupuncture and Chinese herbs a very good combination for this disease, even for dry AMD. So dry AMD, they can't do anything. You just wait for it to go blind. But acupuncture certainly can prevent it to go worse, then make it a bit better. But I don't know whether we can make it to all better. Every case is different. So we have a recent case last week. So one patient from Wellington, her right eye actually improved for 2 levels after 10 acupuncture. And the left eye has no improvement. But by saying that, the vision has no improvement when we check it. But when she closes her eyes, she actually can see the black spot in the middle. And that's become half now, which is improving as well. Right. We will talk more about it next time. Right. And one thing that we want to also share with you, they in America, I think I got some number in here. It's estimated that more than 10 million Americans have this disease. Okay, so this is actually also the number one cause of vision loss. Number one cause of vision loss. That's a lot. That's huge. Then in New Zealand, I think I just Googled. I can see there is something. Let me have a look. I'm pretty sure I have some number of it. I just checked on it just now. Where's the number? I'm pretty sure it said about 1 in 7 people over the age of 60 years is affected by AMD in New Zealand. What I'm looking up on the health navigator.co.nz, it said 1 in 7 people over the age of 60 years is affected by AMD. And AMD may develop slowly, dry AMD, or rapidly wet AMD. So one is a bit slow, one is a bit quicker. AMD causes loss of central vision, which is, I'm reading off the website here. It's needed for task users. Reading showing, okay, this about the same thing. Oh, that's a lot. That's a lot. Over 60 years old. 7 people, if 1 people that actually suffer from AMD. So that is very, very common. It's quite common, right? It's very, very common. How many percent is it actually? 1 out of 7. Let's have a look. 1 out of 7. So over 60 years old. If 100 people, you got 14 people of them, you have AMD. That's huge. That's quite a lot. All right. So we are in Dunsdale, Hamilton. If you're in New Zealand or Australia or wherever you are, you can welcome to come to us. Our phone numbers 078467956, 078467956. We're going to share the different type of macular degeneration and how many percentages they have, and the symptom of macular degeneration, causes of macular degenerations, diagnosis macular degeneration, how to actually diagnose them, and complication of macular degeneration and treatment for macular degeneration, and how to prevent it, and prevention of macular degeneration. Okay, all those things, a little topic. We're gonna go through it a little bit a day, every day. All right, this is the kickstart of today. So that's it for today. Stay awesome, and I love you all. See you tomorrow.